Are you struggling with NCLEX Select All That Apply questions? Don't worry, you're not alone. SATA questions can feel overwhelming, but today we're going to break them down step by step with 50 practice questions, full rationales, and strategies to help you master them. By the end of this video, you'll not only know the right answers, you'll understand why they're correct and how to avoid common mistakes. Stick with me until the end, because these tips could make the difference between passing and failing the NCLEX. 1. A client with congestive heart failure, CHF, has new peripheral edema. Which interventions should the nurse implement? Select all that apply. A. Weigh the client daily. B. Encourage a low-sodium diet. C. Elevate the legs while sitting. D. Restrict fluid intake to 1,500 milliliters per day. E. Apply warm compresses to the legs. Answer: A, B, C. Rationale: daily weights monitor fluid retention, low-sodium diet reduces fluid retention, leg elevation decreases dependent edema. Fluid restriction may be appropriate but is not universally required, depends on orders. Warm compresses can increase circulation but are not standard for CHF edema. Strategy: for CHF stems, pick items that reduce fluid overload or monitor it, weights, sodium, elevation. 2. A client is prescribed furosemide, Lasix. Which should the nurse teach/monitor? Select all that apply. A. Take the medication at bedtime. B. Monitor daily weights. C. Expect increased urination after dose. D. Report muscle weakness or cramps. E. Eat a banana or potassium-rich foods unless taking potassium supplement. Answer: B, C, D, E. Rationale: diuretics cause diuresis and potential hypokalemia, monitor weight and report muscle weakness, potassium-rich foods recommended. Taking at bedtime can cause nocturia, morning dosing preferred. Strategy: for diuretic questions, think urine output up, electrolyte loss, especially K+, weight monitoring, timing to avoid nocturia. 3. A client with type 1 diabetes has an episode of hypoglycemia. Which action should the nurse take? Select all that apply. A. Offer 4-ounce fruit juice if the client is alert. B. Give insulin subcutaneously. C. Check the client's blood glucose immediately. D. After improvement, provide a snack with protein and carbohydrate. E. Administer glucagon IM if unconscious. Answer: A, C, D, E. Rationale: confirm low glucose, treat with quick carb if alert, then give a sustaining snack, glucagon for unconscious clients. Never give insulin during hypoglycemia. Strategy: use the 15-15 rule mentally, treat with 15g quick carbs, recheck in 15 minutes, then snack. 4. Which findings are consistent with increased intracranial pressure, ICP? Select all that apply. A. Bradycardia. B. Irregular respirations. C. Unequal pupil size. D. Rising systolic BP with widening pulse pressure. E. Pinpoint reactive pupils. Answer: A, B, C, D. Rationale: Cushing triad, hypertension with widened pulse pressure, bradycardia, irregular respirations, unequal pupils indicate cranial nerve compression. Pinpoint reactive pupils are more associated with opioid overdose. Strategy: for neurodeterioration, recall Cushing's triad and focal neurosigns. 5. A client receiving total parenteral nutrition, TPN. What nursing actions are appropriate? Select all that apply. A. Monitor blood glucose every 6 hours. B. Change tubing and solution per policy. C. Use peripheral 4 for long-term TPN. D. Observe the catheter insertion site for infection. E. Stop TPN abruptly if hyperglycemia occurs. Answer: A, B, D. Rationale: monitor glucose closely, often Q4-6H, sterile tubing changes per protocol, inspect site for infection. Long-term TPN requires central access, do not stop abruptly, taper to prevent hypoglycemia. Strategy: for TPN, focus on glucose monitoring, sterile technique, central line care, and safe discontinuation. 6. A client in labor receives oxytocin infusion. Which assessments/interventions are correct? Select all that apply. A. Monitor uterine contractions every 15 minutes. B. Discontinue oxytocin if uterine tachysystole occurs. C. Place client in left lateral position for late decelerations. D. Administer 4 fluid bolus for fetal decelerations. E. Increase infusion rate if contractions are weak and fetal heart rate is reassuring. Answer: A, B, C, D, E, all. Rationale: continuous assessment is needed. Discontinue for tachysystole. Left lateral improves uteroplacental perfusion. Fluid bolus can help with hypotension/fetal decels. Increasing rate may be indicated if augmentation is needed and fetus tolerates it. Strategy: labor meds require simultaneous assessment of contraction pattern and fetal response. Intervene quickly for tachysystole or non-reassuring FHR. 7. For a client with neutropenia, which precautions and teachings apply? Select all that apply. A. Avoid fresh flowers and plants in the room. B. Instruct visitor hand hygiene. C. Allow fresh fruit and salads. D. Check temperature every 4 hours. E. Use a mask if the client leaves the room. Answer: A, B, D, E. Rationale: neutropenic precautions, restrict plants/flowers, enforce hand hygiene, monitor temperature often, mask for client when outside room. Fresh produce can harbor bacteria and is usually restricted. Strategy: for immune-compromised clients, select options that reduce infection risk and encourage monitoring. 8. A client with chronic kidney disease, CKD, needs dietary teaching. Which are appropriate? Select all that apply. A. Limit potassium-rich foods. B. Increase protein intake to very high levels. C. Restrict sodium. D. Monitor phosphorus intake and take binders as ordered. E. Avoid high phosphorus foods like cola and dairy. Answer: A, C, D, E. Rationale: CKD diet includes potassium and sodium restriction, phosphorus control and binders. Protein is often limited depending on stage, not necessarily very high. Strategy: with renal diet questions, pick items that limit electrolyte accumulation and reduce fluid retention. 9. A client has asthma. Which measures help manage asthma? Select all that apply. A. Use a short-acting beta-2 agonist for acute symptoms. B. Use inhaled corticosteroid daily for control. C. Avoid allergen triggers. D. Use a spacer with inhaler for better delivery. E. Take beta blockers regularly for blood pressure control. Answer: A, B, C, D. Rationale: SABAs for rescue, inhaled steroids for long-term control, avoid triggers, and spacers improve drug delivery. Beta blockers can exacerbate asthma and are avoided if possible. Strategy: distinguish rescue from controller meds and avoid choices that worsen bronchospasm. 10. For a postoperative client, which findings indicate possible wound infection? Select all that apply. A. Redness and increased warmth around incision. B. Purulent drainage. C. Serous drainage only. D. Temperature 38.5 degrees Celsius 101.3 degrees Fahrenheit. E. Elevated WBC count. Answer: A, B, D, E. Rationale: local inflammation with purulent drainage, fever, and leukocytosis indicate infection. Serous drainage alone is normal postoperative finding. Strategy: compare expected healing versus signs of infection, purulence, systemic signs. 11. A client on warfarin, Coumadin, needs teaching. What should the nurse include? Select all that apply. A. Have INR checked regularly. B. Eat a consistent amount of green leafy vegetables. C. Stop warfarin and take aspirin for headaches. D. Use a soft toothbrush and electric razor. E. Report black tarry stools. Answer: A, B, D, E. Rationale: INR monitoring, consistent vitamin K intake, bleeding precautions, soft toothbrush, and report signs of GI bleeding. Do not substitute aspirin without provider approval. Strategy: focus on monitoring, consistent diet, and bleeding risk prevention. 12. Which are manifestations of hypovolemic shock? Select all that apply. A. Tachycardia. B. Hypotension. C. Warm, flushed skin. D. Decreased urine output. E. Confusion or restlessness. Answer: A, B, D, E. Rationale: hypovolemia leads to tachycardia, hypotension, oliguria, and altered mental status. Skin is typically cool and clammy, not warm/flushed. Strategy: for shock types, recall central findings: tachycardia, hypotension, decreased perfusion. 13. A client with heart failure is prescribed digoxin. Which should be monitored/taught? Select all that apply. A. Monitor apical pulse for 1 full minute before giving. B. Expect visual halos as a sign of toxicity. C. Maintain consistent potassium intake. D. Take an extra dose if a dose is missed. E. Monitor for nausea and vomiting. Answer: A, B, C, E. Rationale: apical pulse check, visual disturbances, GI symptoms, and hypokalemia increase digoxin toxicity risk. Never double doses. Strategy: recognize digoxin toxicity symptoms and safety checks. Apical pulse. 14. For a client with COPD, which teaching points are appropriate? Select all that apply. A. Use pursed lip breathing during dyspnea. B. Stop bronchodilator use when symptoms decrease. C. Get annual influenza vaccination. D. Maintain adequate fluid intake to thin secretions unless contraindicated. E. Avoid high-flow oxygen unless prescribed. Answer: A, C, D, E. Rationale: pursed lip breathing helps reduce dyspnea. Annual flu vaccine recommended. Fluids thin secretions. High-flow oxygen can suppress drive in some COPD. Use per order. Bronchodilators should be continued as prescribed. Strategy: for chronic respiratory disease, choose interventions that improve ventilation and prevent infection. 15. A client has an acute myocardial infarction, MI. Which interventions are appropriate in initial care? Select all that apply. A. Administer aspirin chewable immediately. B. Give sublingual nitroglycerin for chest pain unless contraindicated. C. Start 4-access. D. Administer a beta blocker if no contraindication. E. Encourage bed rest and ambulate as tolerated. Answer: A, B, C, D. Rationale: acute MI protocol includes chewable aspirin, nitroglycerin, for access, and beta blockers if appropriate. Early ambulation is not indicated during acute MI, bed rest initially. Strategy: for acute MI, think ABCs, immediate reperfusion-related steps, and meds that limit infarct size. 16. Which are signs of serotonin syndrome? Select all that apply. A. Hyperreflexia and clonus. B. Hypothermia. C. Agitation and confusion. D. Diaphoresis. E. Bradycardia. Answer: A, C, D. Rationale: serotonin syndrome presents with hyperreflexia/clonus, agitation, autonomic instability including sweating and hyperthermia, not hypothermia, and tachycardia rather than bradycardia. Strategy: look for neuromuscular hyperactivity plus autonomic changes in clients taking SSRIs or serotonergic drugs. 17. A client with pulmonary embolism, PE, may exhibit which findings? Select all that apply. A. Sudden onset dyspnea. B. Pleuritic chest pain. C. Pink, frothy sputum. D. Tachycardia. E. Unilateral leg swelling. Answer: A, B, D, E. Rationale: PE causes sudden dyspnea, pleuritic pain, tachycardia, and may stem from DVT, unilateral leg swelling. Pink frothy sputum is more typical of pulmonary edema. Strategy: acute respiratory/cardiac signs with a DVT history point toward PE. 18. A client is admitted with Addison's disease, adrenal insufficiency. Which should the nurse expect/teach? Select all that apply. A. Hyperpigmentation of skin. B. Hypotension and orthostatic changes. C. Hypernatremia. D. Need for lifelong corticosteroid replacement. E. Risk for hypoglycemia. Answer: A, B, D, E. Rationale: Addison's features include hyperpigmentation, hypotension from low aldosterone, risk for hypoglycemia, and lifelong steroid therapy. Hyponatremia, not hypernatremia, usually occurs. Strategy: for endocrine disorders, recall hormonal deficits and their systemic effects. 19. A client is receiving a blood transfusion. What nursing actions are required? Select all that apply. A. Verify patient ID and blood product with another nurse. B. Monitor vital signs before and during first 15 minutes. C. Hang blood with D5W. D. Stop transfusion immediately and keep 4 open with normal saline if reaction suspected. E. Administer blood at no faster than 10 milliliters per kilogram per hour for all adults. Answer: A, B, D. Rationale: 2-person verification, vital signs pre and during initial transfusion, and stop/keep line open with saline if reaction. D5W is incompatible with blood, infusion rate varies by product and clinical status, no universal 10 milliliters per kilogram per hour rule for adults. Strategy: for transfusions, prioritize verification, monitoring early, and immediate stop with saline if reaction occurs. 20. A client with hyperthyroidism, Graves, may have which manifestations? Select all that apply. A. Heat intolerance. B. Weight gain. C. Tremors. D. Exophthalmos, bulging eyes. E. Bradycardia. Answer: A, C, D. Rationale: hyperthyroidism causes heat intolerance, tremors, exophthalmos, weight loss, not gain, and tachycardia, not bradycardia, are typical. Strategy: for thyroid problems, match manifestations to metabolic rate, hyper equals high, hypo equals low. 21. A nurse is teaching about safe handling of chemotherapy agents. Which are correct? Select all that apply. A. Wear double gloves when administering vesicant chemo. B. Use a biological safety cabinet for reconstitution. C. Dispose of 4 tubing in regular trash. D. Pregnant staff should avoid handling chemo. E. Use designated chemo spill kits for spills. Answer: A, B, D, E. Rationale: chemo safety requires PPE, biosafety cabinet for preparation, special disposal, and pregnant staff avoidance. Tubing contaminated with chemo typically disposed of as hazardous waste, not regular trash. Strategy: for chemo, prioritize staff safety, appropriate PPE, and hazardous waste procedures. 22. For a client with peptic ulcer disease on omeprazole, which statements/actions are correct? Select all that apply. A. Take omeprazole before meals. B. Avoid NSAIDs. C. Smoking cessation to promote healing. D. Antacids should be taken at the same time as omeprazole. E. Report black, tarry stools. Answer: A, B, C, E. Rationale: PPIs are taken before meals, avoid NSAIDs, increase risk, smoking impairs healing, and GI bleeding signs must be reported. Antacids can be used but timing with PPI is not critical, they don't need to be taken simultaneously. Strategy: for GI ulcer questions, remove causative agents, NSAIDs, smoking, and monitor for bleeding. 23. A client with suspected meningitis, what actions should the nurse implement? Select all that apply. A. Place on droplet precautions. B. Obtain blood cultures before antibiotics if possible. C. Give high-dose corticosteroids only after antibiotics. D. Monitor neurological status frequently. E. Dim lights and minimize stimulation. Answer: A, B, D, E. Rationale: bacterial meningitis requires droplet precautions, blood cultures prior to antibiotics if not delaying critical therapy, neuro checks, and reduced stimuli for photophobia/headache. Corticosteroids, e.g., dexamethasone, are often given before or with first antibiotic dose in certain cases. Timing varies. Avoid selecting uncertain timing if the stem is unclear. Strategy: prioritize infection control and neuromonitoring. Be cautious about interventions with time-sensitive ordering. 24. Which are priority actions for a client with suspected stroke, CVA, on arrival? Select all that apply. A. Perform a rapid neurologic assessment, NIHSS. B. Obtain CT scan stat. C. Check blood glucose. D. Administer aspirin immediately without provider order. E. Determine time of symptom onset. Answer: A, B, C, E. Rationale: rapid neuroassessment, immediate CT to distinguish ischemic from hemorrhagic stroke, check glucose, hypoglycemia can mimic stroke, and determine onset time for TPA eligibility. Administering aspirin without order is not appropriate in acute setting pre-imaging. Strategy: for stroke, focus on time-sensitive diagnostics and contraindications for thrombolytics. 25. A client with Parkinson's disease should be taught which measures? Select all that apply. A. Take levodopa-carbidopa on an empty stomach for best absorption. B. Expect improvement to be immediate and permanent. C. Use assistive devices to prevent falls. D. Avoid high-protein meals around medication times. E. Report sudden inability to move, on-off phenomenon. Answer: A, C, D, E. Rationale: levodopa absorption affected by protein, assistive devices reduce falls, on-off phenomenon can occur, improvement may not be immediate/permanent. Strategy: for chronic neuromeds, note interactions with diet and motor fluctuations. 26. Which are signs of magnesium sulfate toxicity in a pre-eclamptic client receiving 4-magnesium? Select all that apply. A. Absent deep tendon reflexes. B. Respiratory depression. C. Elevated blood pressure. D. Decreased urine output. E. Bradycardia. Answer: A, B, D, E. Rationale: MG toxicity causes loss of reflexes, respiratory depression, oliguria, decreases excretion, and bradycardia. Elevated BP is not a sign of toxicity. Strategy: monitor reflexes, respiratory rate, and urine output when giving magnesium, stop infusion and give calcium gluconate if toxic. 27. A client newly diagnosed with rheumatoid arthritis, RA. Which should be taught/expected? Select all that apply. A. Morning stiffness lasting greater than 1 hour. B. Use of disease-modifying anti-rheumatic drugs, DMARDs, like methotrexate. C. Encourage high-impact exercise daily. D. Bilateral joint involvement is common. E. Report signs of infection while on immunosuppressants. Answer: A, B, D, E. Rationale: RA causes prolonged morning stiffness, symmetric joint involvement, DMARDs usage, and immunosuppression increases infection risk. High-impact exercise is not recommended, gentle ROM and low-impact exercise are better. Strategy: differentiate RA from osteoarthritis, OA, and focus on systemic therapy and safety precautions. 28. For a client with sickle cell crisis, which interventions are appropriate? Select all that apply. A. Provide vigorous hydration. B. Give oxygen if hypoxic. C. Apply cold packs to painful areas. D. Administer opioid analgesics as ordered. E. Encourage early ambulation during peak pain. Answer: A, B, D. Rationale: hydration, oxygenation, and analgesia are key. Warm compresses, not cold, may relieve vaso-occlusive pain. Ambulation during acute severe pain is not appropriate until stabilized. Strategy: for vaso-occlusive crisis, prioritize hydration, oxygen, and aggressive pain control. 29. A client with MRSA infection, what precautions and teaching? Select all that apply. A. Place on contact precautions. B. Use dedicated equipment or disinfect between clients. C. No need to cover wounds when leaving room. D. Hand hygiene before and after patient contact. E. Inform cleaning staff to use standard cleaning, no special measures. Answer: A, B, D. Rationale: MRSA requires contact precautions, dedicated/disinfected equipment, and strict hand hygiene. Wounds should be covered when leaving the room. Environmental cleaning may require attention per facility policy. Strategy: select measures that prevent contact transmission and environmental contamination. 30. A client with hypokalemia, K plus 2.8 milliequivalent/L, may show which signs? Select all that apply. A. Muscle weakness. B. Arrhythmias, especially PDCs. C. Constipation. D. Increased deep tendon reflexes. E. Flattened T waves on ECG. Answer: A, B, C, E. Rationale: hypokalemia causes muscle weakness, GI slowing, arrhythmias, and ECG changes like flattened T waves. Reflexes are typically decreased, not increased. Strategy: recognize electrolyte disturbance signs and ECG correlations. 31. Which are appropriate for post-op prevention of deep vein thrombosis, DVT? Select all that apply. A. Early ambulation. B. Sequential compression devices, SCDs. C. Encourage bed rest for 48 hours. D. Anticoagulant prophylaxis per order. E. Leg massages to promote circulation. Answer: A, B, D. Rationale: early ambulation, SCDs, and pharmacologic prophylaxis reduce DVT risk. Leg massage is contraindicated in DVT risk because it may dislodge a clot. Prolonged bed rest increases DVT risk. Strategy: choose interventions that promote circulation and reduce clot formation, avoid actions that could embolize a clot. 32. A client with Clostridium difficile, C. diff, infection, which measures apply? Select all that apply. A. Contact precautions with gown and gloves. B. Use alcohol-based hand rub after glove removal. C. Use soap and water for hand hygiene after contact. D. Clean room surfaces with bleach-based disinfectant. E. Encourage probiotics to treat acute infection. Answer: A, C, D. Rationale: C. diff requires contact precautions. Hand washing with soap and water is necessary as alcohol rubs are less effective. Bleach-based disinfectants recommended. Probiotics are not primary acute treatment. Treatment is antibiotics like vancomycin or fidexomycin. Strategy: for spore-forming organisms, prioritize hand washing and environmental decontamination. 33. A client with postural, orthostatic, hypotension, which teaching/interventions? Select all that apply. A. Rise slowly from lying to sitting to standing. B. Increase salt intake without provider approval. C. Wear compression stockings. D. Sit on the edge of the bed and dangle before standing. E. Avoid prolonged standing and hot showers. Answer: A, C, D, E. Rationale: slow position changes, compression stockings, dangling prior to standing, and avoiding prolonged standing/hot showers reduce orthostatic symptoms. Increasing salt should be individualized and guided by provider, especially with cardiac/renal issues. Strategy: prevention of syncope relies on gradual position changes and supportive measures. 34. A client with hepatitis B, which instructions are appropriate? Select all that apply. A. Avoid alcohol consumption. B. Use barrier contraception until cleared. C. Share razors with household members. D. Practice good hand hygiene and cover wounds. E. Encourage vaccination of household contacts if susceptible. Answer: A, B, D, E. Rationale: avoid alcohol to reduce liver strain, use barrier contraception until infectivity resolves, do not share razors, vaccinate susceptible contacts. Strategy: for infectious hepatitis, think transmission prevention and liver health promotion. 35. For a client with chest tube after thoracotomy, what are appropriate nursing actions? Select all that apply. A. Keep the drainage system below chest level. B. Milk the chest tube vigorously every hour. C. Monitor for continuous bubbling in water seal chamber. D. Encourage deep breathing and coughing with splinting. E. Clamp the tube frequently to assess for air leaks. Answer: A, C, D. Rationale: keep drainage below chest. Bubbling in water seal chamber may indicate air leak and should be assessed. Encourage pulmonary hygiene. Milking tubing is rarely recommended and can cause high negative pressures. Follow facility protocol. Clamping is only done when ordered and briefly for specific assessments. Strategy: protect system integrity, assess for air leaks, and promote lung expansion. 36. Which are common side effects of ACE inhibitors, e.g., lisinopril? Select all that apply. A. Dry cough. B. Hyperkalemia. C. Angioedema. D. Orthostatic hypotension. E. Hypoglycemia. Answer: A, B, C, D. Rationale: ACE inhibitors commonly cause dry cough, can raise potassium, may cause angioedema, and cause hypotension. Hypoglycemia is not a common side effect. Strategy: for med class questions, recall class effects and dangerous adverse effects. 37. A client with newly placed suprapubic catheter, what teaching and care are correct? Select all that apply. A. Keep the drainage bag below bladder level. B. Clean insertion site per protocol and observe for infection. C. Secure tubing to prevent tension on catheter. D. Clamp tubing daily to prevent bladder contracture. E. Empty drainage bag when half full. Answer: A, B, C, E. Rationale: keep bag below bladder, maintain site hygiene, secure tubing, and empty before heavy to avoid backflow. Routine clamping is not recommended unless ordered for a specific reason. Strategy: maintain closed sterile system, prevent traction, and monitor for infection. 38. For a client with anxiety disorder starting in SSRI, which info should the nurse provide? Select all that apply. A. Therapeutic effects may take several weeks. B. Expect immediate relief of anxiety within hours. C. Report increased suicidal thoughts, especially early in therapy. D. Avoid alcohol while taking SSRIs. E. Abruptly stop medication when feeling better. Answer: A, C, D. Rationale: SSRIs take weeks for effect, monitor for suicidal ideation early, avoid alcohol that can worsen depression/anxiety. Do not abruptly stop SSRIs due to withdrawal. Strategy: emphasize onset of action, safety monitoring, and adherence. 39. A client with hyperkalemia, K plus 6.5 milliequivalent/L. Which interventions may be used emergently? Select all that apply. A. For calcium gluconate. B. For regular insulin with dextrose. C. Kayexalate, sodium polystyrene sulfonate, orally or rectally. D. For potassium chloride bolus. E. Administer nebulized albuterol. Answer: A, B, C, E. Rationale: calcium stabilizes cardiac membrane, insulin shifts K into cells with dextrose to prevent hypoglycemia, ion exchange resins, Kayexalate, remove K via GI tract, and nebulized albuterol also shifts K intracellularly. Potassium chloride would worsen hyperkalemia. Strategy: for hyperkalemia, think membrane stabilization, shifting K intracellularly, and removing excess. 40. A client with bacterial endocarditis, which are anticipated orders/teaching? Select all that apply. A. Prolonged 4 antibiotics. B. Avoid dental procedures until cleared. C. Monitor for petechiae and splinter hemorrhages. D. Encourage strenuous exercise to improve circulation. E. Report new murmur or signs of embolic events. Answer: A, B, C, E. Rationale: endocarditis requires prolonged 4 antibiotics, avoid procedures that risk bacteremia, monitor for embolic signs, and report new murmurs. Strenuous exercise is not advised during acute infection. Strategy: focus on infection eradication, embolic risk, and vigilance for complications. 41. A client on long-term corticosteroids should be taught which points? Select all that apply. A. Do not stop medication abruptly. B. Expect increased susceptibility to infection. C. Encourage high-sodium diet to prevent adrenal insufficiency. D. Monitor for hyperglycemia and weight gain. E. Bone density may decrease, consider calcium/vitamin D. Answer: A, B, D, E. Rationale: tapering required to avoid adrenal insufficiency, steroids increase infection risk, cause hyperglycemia and weight gain, and long-term use lowers bone density, calcium and vit D helpful. High-sodium diet is not routinely encouraged, steroid side effects include fluid retention, so sodium may need moderation. Strategy: for steroids, emphasize tapering, infection precautions, metabolic effects, and bone health. 42. For a client with dehydration, which assessment findings are expected? Select all that apply. A. Dry mucous membranes. B. Decreased skin turgor. C. Bounding pulse. D. Increased urine-specific gravity. E. Hypotension and tachycardia. Answer: A, B, D, E. Rationale: dehydration causes dry mucous membranes, decreased skin turgor, concentrated urine, high specific gravity, hypotension, and tachycardia. Bounding pulse is associated with fluid overload. Strategy: correlate signs of low intravascular volume, tachycardia, hypotension, concentrated urine. 43. A client with atrial fibrillation, AFib, which are appropriate interventions/orders? Select all that apply. A. Rate control with beta blocker or calcium channel blocker per order. B. Anticoagulation to reduce stroke risk as indicated. C. Electrical cardioversion without assessing for anticoagulation status if chronic AFib. D. Monitor for signs of thromboembolism. E. Teach about irregular pulse and palpitations. Answer: A, B, D, E. Rationale: rate control and anticoagulation as indicated, cardioversion requires assessing anticoagulation and thrombus risk. Monitoring for embolic events and patient education about symptoms are appropriate. Strategy: for AFib, consider both rhythm/rate management and stroke prevention. 44. A client with compartment syndrome of the lower leg, which are expected findings/interventions? Select all that apply. A. Pain out of proportion to exam. B. Pallor, paresthesia, pulselessness, paralysis, late signs. C. Elevate limb above heart level. D. Notify provider immediately for possible fasciotomy. E. Apply compressive dressing to reduce swelling. Answer: A, B, D. Rationale: severe pain, neurovascular changes are classic, fasciotomy is emergent. Elevation above heart may reduce perfusion and worsen ischemia, compressive dressings worsen compartment syndrome. Strategy: recognize 6 Ps and avoid measures that increase compartment pressure, act emergently. 45. Which are correct for a client using a metered dose inhaler, MDI? Select all that apply. A. Shake the inhaler before use. B. Hold breath for about 10 seconds after inhalation. C. Exhale gently before using the inhaler. D. Rinse mouth after using an inhaled corticosteroid. E. Take 2 puffs at once without waiting between puffs. Answer: A, B, C, D. Rationale: shake MDI, exhale before use, hold breath after inhalation for 5 to 10 seconds, and rinse mouth after steroid inhaler. Wait recommended interval, usually about 30 to 60 seconds, between puffs for optimal delivery. Don't take both puffs simultaneously. Strategy: for inhaler technique, focus on sequence, exhale, actuate while inhaling slowly, hold breath, wait and repeat. 46. A client with gastric dumping syndrome after gastrectomy, which dietary measures help? Select all that apply. A. Eat small frequent meals. B. Drink fluids with meals to aid digestion. C. Avoid high sugar foods. D. Lie down after meals to slow transit. E. Eat high carbohydrate, low protein meals. Answer: A, C, D. Rationale: small frequent meals, avoid simple sugars, and lying down can reduce rapid gastric emptying. Drinking fluids with meals can worsen dumping. Protein is preferred to high carb. Strategy: for dumping, choose actions that slow gastric transit and minimize hyperosmolar loads. 47. Which are signs of magnesium deficiency? Select all that apply. A. Muscle cramps and tremors. B. Positive Chvostek sign. C. Hyporeflexia. D. Cardiac arrhythmias. E. Tetany. Answer: A, D, E, and possibly B, but best selection, A, D, E. Rationale: hypomagnesemia causes neuromuscular excitability, cramps, tremors, tetany, arrhythmias. Chvostek sign is more associated with hypocalcemia but may coexist. Reflexes tend to be increased rather than decreased. Strategy: electrolyte deficiencies often present with neuromuscular and cardiac changes, match signs to the specific ion. 48. A client with burns covering 40% TBSA. Which are priority nursing actions in first 24 hours? Select all that apply. A. Secure airway and assess for inhalation injury. B. Start large bore 4 access and begin fluid resuscitation. C. Apply ice directly to burns to reduce temperature. D. Elevate extremities and immobilize fractures. E. Monitor urine output hourly. Answer: A, B, D, E. Rationale: airway assessment, aggressive fluid resuscitation with large bore IVs, immobilization of fractures, and urine output monitoring are priorities. Do not apply ice directly, risk tissue damage. Strategy: in major burns, airway and fluid resuscitation are the first priorities, ABCs, then monitoring organ perfusion. 49. A client with a tracheostomy. Which are appropriate care measures? Select all that apply. A. Suction PRN using sterile technique. B. Change tracheostomy ties daily using one-person method. C. Keep spare obturator and trach tube at bedside. D. Humidify air to prevent thick secretions. E. Deflate cuff routinely for all patients to assess speech. Answer: A, C, D. Rationale: suctioning sterilely as needed, keep spare equipment at bedside, and humidification are correct. Tracheostomy ties are typically changed with a two-person technique for safety and not necessarily daily unless soiled. Cuff deflation should be done per provider order and patient readiness, not routine for all. Strategy: prioritize airway safety, sterile technique, and emergency preparedness.